Welcome back to Ask Dr. Moore. And today I was watching football earlier, so let's tackle a very common FAQ or Google frequently asked question. How do you treat a foot sprain? We'll also go over home remedies and when it's time to see a professional. Earlier, we talked about ankle sprains, and that's usually around this region. The foot is described and defined by anything below the tibia and the fibula. So that would include the talus, or the bone inside the ankle joint, and the rest of them. There's about 26, unless you have accessory ossicles, different extra bones that are in the foot and ankle. Now, by the area of the foot, it does change the treatment. And of course, like the ankle, there's different classifications, grade 1, 2, and 3. 1 is kind of a tweaking or pulling of the ligament and tendons. 2 is a partial tear, and of course, 3 is a complete tear. The ligaments in the midfoot and also the forefoot are things that are involved in the sprains and strains, but the inside of the foot and underneath from the tendons come around the bottom of the ankle joint. Well, on the inside of the navicular, there's the posterior tibial tendon. That's a pretty serious sprain. Is just like the fifth metatarsal base, which sometimes has a pull of this tendon, the peroneus brevis, or goes on to a fracture. Now, this middle area is the most critical because straining this too much can collapse the archway, and of course that can lead to long-term care or even surgery. The middle of the foot, there are ligaments and tendons around all these MTP or metatarsal phalangeal joints. The most common is turf toe, and that's when the big toe gets jerked upwards. Although we have plenty of injuries where they're jerked downwards, and the tip of the toe underneath the toenail has a tendon that can pull away. It's very, very painful. Also, it takes a long time to heal. Home remedies, rice is rest, ice, compression, and elevation. That is probably more for a grade 1. If you think you're in that grade 2 stage and you can't see a professional until after the weekend, I would elevate, I would stay off of it, maybe get some crutches. At the office, standard x-ray and an MRI will tell what level it is, and most patients leave with a walking boot. If it's serious, of course, a walking boot, or cast and crutches. Non-steroidal anti-inflammatories like your Advil, Aleve, which is ibuprofen and naproxen, those are starting to fade away because of a study that shows some delayed healing in the beginning if you take these drugs. So I would recommend Tylenol and elevation and of course rice, the rest of that, until you can be seen. Again, hopefully that was helpful. If you want to see more videos, surgeries, things of that nature, you can log on to my YouTube channel, Dr. Robert J. Moore III. Then also we have an Ask Dr. Moore channel with several of these videos. Also, if you don't see one you like, you can submit one underneath the comments, and I'll try to get your question as best as I can.